Are you confused about how to write a nursing school care plan in nursing school? Trust me, we've all been there, my friend. But it is totally possible to ace your care plans, and I'm gonna show you how in this video. Let's go. So I remember writing my first care plan, and it took me like hours to write the simplest care plan I think I have ever done in my entire life. It's just when you first start writing them, it can be a lot. It can be really overwhelming, but really it doesn't have to be. So in this video, I'm gonna walk you through how to make it easier, okay? And it starts with your nursing diagnosis. So a lot of nursing students freak out about the nursing diagnosis, but I promise you, it's not that complicated, okay? So the first thing you need to know is that all nursing diagnoses are standardized. It is so cool. So all you need to do is choose from a list. You don't make them up yourself. You just choose from a list, and I'll tell you exactly where to get that list. I love this book. This is the Nursing Diagnosis Handbook by Ackley and Ladwig. You have got to get this if you don't have it yet. It literally writes your care plan for you, my friend. So, so great. So in the front here, it actually lists out right here, right in the front, all the nursing diagnoses that you can use. So you just have to choose from that list. That's it. It really is that simple. So once you've chosen your nursing diagnosis from that list, the next part is the related to factor. So think of the pathophysiology here. This is where a lot of nursing students lose points, okay? Listen up. Here in the related to factor, really dive deep and consider the pathophysiology for what is actually happening with your patient. This is a fantastic place in your nursing care plan to really make your care plan shine and show your instructor that you really know what you're talking about, okay? It can really, really impress them if you actually understand the pathophysiology behind what is going on with your patient. The third part of your nursing diagnosis is the as evidenced by. Now, this is where you will just put the signs and symptoms of what your patient is experiencing as it relates to that nursing diagnosis that you chose. So if your patient is experiencing diabetes, what signs and symptoms would you include there with your patient experiencing that? Maybe things like high blood glucose level, right? You would probably want to put a number. So like a blood glucose level of 180, right? Or urine ketones, present urine ketones, things like that. Anything that is like as evidenced by, those are just signs and symptoms of things that your patient is experiencing as it relates to the nursing diagnosis. Now, the second column are your patient goals. Now, here is where it is patient-centric, okay? Remember this. Everything in your patient goal column should start with the patient will. All right, these are things that the patient will do. In the next column, it changes, but for this column, this is patient goals. So the patient will do this. And here you will want to check with your nursing school because most nursing schools do require that you add a time constraint to these statements, to these goals that you make for your patient. So the patient will do X, Y, and Z by 0700 tomorrow. Okay, so there's a deadline to it. The patient will do X, Y, and Z before discharge, right? So there's a time frame for when your patient will reach their goal. And that goes in the patient goals column. Now in the next column, this is where it's all about you as the nursing student, right? Or the nurse, the nursing interventions. These are all things that you will do as the nurse in order to help your patient reach those patient goals. So the nurse will. So you see how this changes. In the previous column, it was the patient will, but now in the nursing interventions column, it's the nurse will. So what are you going to do as the nurse to help your patient reach those goals? And this column can be a little tricky too, because not only will you include what you will do as the nurse in order to help your patient reach their goal, but also your nursing school will most likely require you to add a rationale to it. So you'll need to say, why will you do that nursing intervention? You have to actually more critically think through it and find some evidence-based practices and evidence-based reasons for doing those nursing interventions that you chose for your care plan. So this nursing interventions column is really two parts. It's the nurse will do this, to help your patient reach your goal, right? So you have the nurse will do whatever you're gonna do, and then you tell the reason why you will do it. And then the last column of your nursing school care plan is the evaluation column. Now, this is really just an assessment all over again. So the evaluation column, you will say whether or not your patient met their goal. So if they met it, fantastic. You don't have to do anything else. They met it. That's great. Everything's fine and dandy. But if they didn't meet their patient goals, then you have to explain why they didn't meet it and what you would do differently next time. So what would you change in your care plan in order to help your patient meet their goal next time? And I have some fantastic nursing care plan examples for you, totally free, that I want to send to you. They're in a link down below in the description for you to snag them. Definitely don't miss them. They're gonna help you so much. And really, the hardest part of your nursing care plan is that nursing diagnosis oftentimes. It is tough to kind of structure it, to pick what nursing diagnosis is best from the NANDA list and creating the pathophysiology related to factor, right? And that has evidence by, it can be kind of tricky. So in this video, I'm gonna walk you through exactly how to do it and to make it so much easier for you. So I will see you over there in that video, and go become the nurse that God created only you to be. I'll see you over there. Take care. Bye.